So every time when I'm taking classes and we are doing repertorization, so most of the people, they say it's like, they are not getting the same medicines which I am getting. Then I will tell them the problem is regarding, the grading of the symptoms which you are getting. Because the grading is very important, what to take from a case. Now today we are going to show more than 10 cases of diabetes and the complications. As you know, we are treating the patient, not the disease, not the diabetes. If a diabetic ulcer, if the diabetic patient, if he has a pain and it's sensitive, it's good. Because the vitality is reacting, right? This is the eruption. So you can see the eruption with pus, okay? The pus. And after the medicine, see it's been cured from the center. See, it's going up, full of granulation tissue. This is called granulation tissue. So I said to apply. See, these things are pus. After the medicine, this is coming out as exudates. You know the exudates. So you have to clean that. Otherwise, the granulation tissues will not come up. So you can use echinacea for that. In this case, I used directly. I didn't, dilute it because the patient is not having any pain or sensitive sense. So I just used directly, and it's coming down. See, it's totally going. It's healing. These things are called granulation tissues. It's very good. You have to look for the granulation tissues in a case of diabetes ulcer or ulcers which are having a lesser blood circulation. It's very important. And this is almost healed. Yes. Yeah, healed. It took almost 1 month because the patient is like, it's 75-year-olds and long-term diabetes. I think more than 40 years she's having diabetic. She's answering to me. See, she's answering as well, but it's difficult for her. See, she's answering, but it's very low and she is not looking. And this case, in 14 days, she became normal. I will show the pictures. This was the first day. And see, after the first dose, see, it's dried up. See, it's coming down. See, it was here. See, it confined to here. See, it's getting clear. It's getting clear. Clear. Almost gone. That's good.
How many times?
She's good.
Time?
What medicines?
I mean,
In 14 days.
14 days.
Yeah. No, it's not big thing. In 14 days you can cure a case of shingles. But meanwhile, she did not have any pain. That's very, very important when you treat herpes zoster, because herpes zoster is notorious for having immense pain. I will show a cough.
ചുമയ്ക്കുമ്പോൾ വലിച്ചോളൂ. വെള്ളം കുത്ത ചുമയ്ക്കുമ്പോൾ വലിച്ചോളൂ.
This is after medicine, last one. What is this? What sort of cough is this? You were asking about the cough. Huh? This is inspiratory woof, right? Inspiratory woof. That is inspiratory woof. This is a case of, it's like breathing difficulty. Taken allopathic medicines and not relief. Usually starts with coughing. Must sit up during the cough, aggravation at night, sleep during, and warm room aggravates. mild child desires cold drinks. This is the case. I got a video, so you can see. And why not sepia? Sepia is covering all the things, right? See? Phosphorus is not covering respiration difficult warm room aggravation. That's why phosphorus is not coming up, because phosphorus is amelioration by that. In acute diseases, you should be cautious regarding the symptoms of the patient which supports the disease, right? That is amelioration or aggravation. That's very important with acute diseases. Every other month you have to go for the the glucose test and all. And if it is okay for the consecutive 6 months, you can tell that it's controlled. Apart from that, the important thing is when you are treating a diabetes, the problem is with the food and the regimen and the exercise. It's very important because the food what you are taking is very important, especially in the Indian standards. They are using a lot of grains, 3 times, 4 times they are taking grains, rice with white rice and all. They are very, everything they they eat, it includes the white rice. Even for the breakfast, lunch and the dinner. Even they take the wheat and rice are not that much different. Sometimes the wheat has got more glycemic index than the rice. Sometimes the wheat is having more glycemic index. So better I will advise the people to restrain all such food like with white rice and most probably the grains. I will ask them to stop if they want to take that with bran. The rice with the bran, you will get a whole grain or a brown rice you will get from there. So and avoid all the the fast foods. Fast foods are very dangerous. The biscuits, rusk, all these things are very dangerous. Ice creams, all this. I will ask them to restrain from this. Otherwise, you can't able to control the diabetes because. Sorry.
All the good stuff.
All the good stuffs. It's supposed to be the good stuffs, that's all. So it's difficult to control if they are taking all these things, especially the dinner, because that is the 2 marks. Like the generals, that is a medium grade. So most probably, we are good in taking the medium grade symptoms, right? Because the physical things we will ask them. But for the correct core, we need a high grade and super grade. High grade, the thing is, see, the super grade, it is easy. Because it is easy to know a patient is idiotic or intelligent, artistic or benevolent. It is easy. But when it comes to the 3rd grade, 3 marks, or the high grade, emotional, that is difficult. For that, you need an objective study. You have to ask the relatives or the people who are with them. But the super grade, it is good because for the super grade, you can directly ask them, or you from the occupation they are doing, from the activities, from talking to them, you can know that whether the guy is high IQ, artistic, like that. So. The generals, the importance of the 2 marks symptom, the medium grade is that it will be clear, because the person will clearly tell what is that. You don't have to assume, because assumption is a big pitfall in the case taking. If you assume the general, that means you destroy the case. But the physical generals, you don't have to assume, because how is your menses? Oh, my menses is protracted. How is your mood during menses? I am very bad at the menses. How is your, what is your desire? I would like to take salt. What you don't take, I don't like oysters. That's very clear, because that symptoms you will get very clearly. But the emotional sphere, that is the high grade, it is difficult. So be cautious when you are taking the high grade. Because if you have a problem with the high grade, it is 3 marks. So there will be chances for getting the wrong medicines. We have a lot of cases of psoriasis cured cases in which you can't find all these things. Maybe a little bit of change from the home, maybe a little bit of love disappointment with the mother, sister, or even the romantic relationship. I have found in many patients they have a history of disappointment from love. It's not cliche, it's not mandatory, but maybe 80% of cases you can find love disappointment. In psoriasis cases, you just ask them. Likewise, in thyroid, hypothyroid cases, you have some sort of conflict with the authority. Because the people who has got the thyroid, hypothyroidism, normally it will happen after, there will be a change in the lifestyle. Maybe after the marriage, maybe after, get adolescent, they will have some conflicts with the authority. Maybe they will change after getting a transfer from the office they were working with which was normal condition, they change to another office, the authority will be, suppressing them. Then there is a chance of getting, it's not cliche, it's not like something which is, but when you go through the cases, you will get all sorts of things. So it will be easier for you to know which is the maintaining cause, and you have to tell them to remove that maintaining cause. Otherwise, we can't able to cure that. Now she is participating in marriage, she is smiling. Before that, it was like mummified or mortified like that. Because of that, now she could able to realize that this is the world. The world is like this. This is the life, and she could able to realize. So the importance is if on the other hand, if she had gone for some sort of insulin or whatever, what happens? She will degrade, right? She will degrade and degrade and degrade. That's what homeopathy offers to the society. That's what the principle of homeopathy, and that's what the goodness of homeopathy. We can't able to cure all the patients. No, it's not possible, because maybe the doctors are not that much, into that, because the rapport and the harmony should be there. Sometimes according to sometimes the maintaining cause will be there. So we can't able to remove the maintaining cause, but most of the cases you can do that.
So during the seminar you have explained your new method.
Yeah.
And if you follow that method, you will always reach to the correct remedy.
Yeah.
Can you tell me something about this new method?
Okay. Actually speaking, this is not. It's a new method, anyways, but it's basically the Hahnemannian principles.
Mm-hmm.
I just made it categorized or made it in a structure, because the people are confused about reading all the chronic diseases and organon and all. People can't able to collect all the things what Hahnemann meant to be done in a homeopathic prescription. Mm-hmm. So this is like what I did is it's a grading of symptoms. If you are taking a case and you can grade the symptoms, I have given 4 grades, like a super grade, high grade, medium grade, and a normal grade, according to the hierarchy of the symptoms and according to the core of the patient. So it depends upon how much importance is that symptom in a particular case. So if you're aware of, anyway, you guys are all aware of what to be taken and not. But the thing is, if you have that the particular formula or the particular scheme, it would be easier for you to look after the symptoms. And even after repertorization, you will get a clear picture of which medicine you have to give. And even this scheme is helpful for as a tool. Because when you are taking a case, if the scheme is there, you can ask the particular symptoms to the patients.
Mm-hmm.